Recurrence. In the context of oncology, the study and treatment of cancer, recurrence refers to the reappearance of cancer after a period of remission or after the completion of treatment. Cancer recurrence is a significant concern for both patients and healthcare providers because it indicates that cancer cells have survived the initial treatment and are regrowing or spreading again. Recurrence can occur locally, in the same area as the original tumor, regionally, in nearby lymph nodes or tissues, or distantly, metastasis to distant organs or tissues. There are different types of cancer recurrence. Local recurrence. This occurs when cancer returns in the same location as the primary tumor after treatment. It suggests that some cancer cells were not completely eliminated during the initial treatment or that the tumor was not entirely removed. Regional recurrence. This type of recurrence happens when cancer returns in nearby lymph nodes or tissues, close to the site of the original tumor. It indicates that cancer cells have spread to nearby areas despite the initial treatment. Distant metastasis. Distant recurrence occurs when cancer spreads to other parts of the body far from the site of the primary tumor. This type of recurrence is a more severe stage of cancer and may involve organs such as the liver, lungs, bones, or brain. Causes and risk factors for recurrence. The mechanisms behind cancer recurrence can vary based on the type of cancer, the stage at diagnosis, the effectiveness of the initial treatment, and the genetic characteristics of the tumor. Some common reasons for recurrence include resistant cancer cells. Some cancer cells may develop resistance to the initial treatment, leading to their survival and regrowth. Micrometastases. Tiny cancer cells that have spread but are not detectable at the time of diagnosis can remain dormant for a period and later start growing again. Incomplete treatment. If the initial treatment is not aggressive enough or does not completely remove all cancer cells, there is a higher chance of recurrence. Genetic mutations. Genetic changes in cancer cells can lead to the development of more aggressive and treatment-resistant cell populations. Immune system evasion. Cancer cells can sometimes evade the immune system's surveillance and destruction, allowing them to survive and grow. Managing recurrence. Managing recurrence. The management of cancer recurrence depends on various factors, including the type of cancer, the extent of recurrence, the patient's overall health, and previous treatment history. Treatment options may include surgery. If the recurrence is localized, surgical removal may be an option to eliminate the recurrent tumor. Radiation therapy. Targeted radiation can be used to treat localized recurrences or to alleviate symptoms caused by metastases. Chemotherapy. Systemic chemotherapy may be used to treat disseminated or widespread recurrences. Targeted therapy and immunotherapy. These treatments may be employed if the cancer has specific genetic mutations or if the immune system can be stimulated to target the cancer cells. Palliative care. In cases of advanced or widespread recurrence, the focus may shift to palliative care to manage symptoms and improve quality of life. How to prevent recurrence? Preventing recurrence. While preventing cancer recurrence entirely is not always possible, there are steps that individuals can take to reduce the risk. Adhering to treatment plans. Following the recommended treatment plan and attending regular follow-up appointments are essential to monitor for any signs of recurrence. Healthy lifestyle. Adopting a healthy lifestyle, including regular exercise, a balanced diet, and avoiding tobacco and excessive alcohol consumption, can help promote overall well-being and potentially reduce the risk of recurrence. Early detection. Regular cancer screenings can aid in detecting any recurrence or new cancer at an early stage, increasing the chances of successful treatment. Clinical trials. Participating in clinical trials may offer access to innovative treatments that could improve outcomes. Overall, cancer recurrence is a complex and challenging aspect of oncology. A comprehensive approach involving early detection, effective treatment, and ongoing monitoring can help in managing recurrence and improving the prognosis for cancer patients. Patients should work closely with their healthcare team to develop a personalized follow-up plan tailored to their specific circumstances.